Without doubt, the biggest story of the moment is the coronavirus, and it's set to be the major global challenge and therefore media focus of the whole year. There's a hell of a balancing act to be played out here, alerting the community but not causing unnecessary alarm. So, how are we going?
Death toll has risen above 3,100. Let's go live to our team of reporters. First to Sam Brett at Riot Hospital in Sydney. Sam, the new economic modelling of the impact of the virus paints a fairly bleak picture.
It certainly does, Sam. Good morning. These are frightening statistics. Of course, only predictions at this stage, but this does come from a leading economist. A former RBA board member, Warwick McGibbon, has come out and said that if there is a mild pandemic, he is predicting 21,000 Australians will die this year. If it gets more serious, 53,000 deaths, and in the worst case scenario, 96,000 people could die. 68 million people worldwide. Now, these numbers just keep on rising.
Now, that sounds alarming enough, doesn't it? Especially with that little cough in the background. But as we've seen, whatever the media, experts and politicians have been saying, there's been an inexplicable rush on toilet paper that's generated a media cycle all of its own.
Meanwhile, the panic of purchasing toilet paper has reached a new low.
Hey, stop! That's enough!
The supermarket wars, hey? Alan Dupont's article in the Weekend Australian was headed "Nowhere to hide from the spread of panic." The biggest behavioural challenge for government and business will be dealing with the fear pandemics inspire. For all our supposed rationality and access to unprecedented levels of information and knowledge, fear of disease is still deeply embedded in the human psyche. This frequently results in irrational or selfish behaviour that can worsen the social and economic impact, as Australians found out this week when panicked buyers stripped supermarket shelves of toilet paper, sanitisers, disinfectant and food. The ABC also noted that our fear of coronavirus could be far more contagious than the disease itself. They quoted a Cardiff University professor who noted that coronavirus is playing out through the lens of a hybrid media system where traditional mainstream media and social media collide. It means misinformation and alarmist material like a decade-old map showing global air travel purporting to illustrate the spread of coronavirus has circulated through mainstream outlets untested. There's no doubt that the communication age means the awareness is more contagious than the virus. This should be a good thing. But is it? Depends on the particular reports and on your own perspective. Here's some of 60 Minutes from last night.
Professor Gabriel Leung believes 60% of the world's population could become infected with the virus, and that as many as 45 million of us might be killed by it.
A world where people only venture out in masks, where almost all public places are deserted for fear of infection, where businesses are deserted and economic markets are in panic. And this may only be the start.
We've seen that panic on the markets already, haven't we? But that's pretty alarming stuff. Those are high estimates, especially when we know that most people's infection will be dealt with reasonably easily. But still, we do need the facts, and estimates vary on various scenarios. And 60 Minutes also did the hard yards, showing us the animal markets and practices that have been shown time and time again to be the critical points where deadly viruses transfer from wildlife to humans.
Then, deep within the market, a single shop that should rightly terrify a world reeling from coronavirus. An African serval cat, a fennec fox from the Sahara, and marmosets from South America.
This is just incredible. You know, African cats, snakes, you've got monkeys, primates, in the same confined space. Has no one told these people that this is where the other viruses came from?
As for the other crucial factors back home, here's how 60 Minutes summarised them.
Whether you live or die depends on two things: how Australia's health authorities and hospitals cope with this pandemic, but mainly how old you are.
True enough, but pretty dramatic. Tone is a matter of taste in many respects, but maybe sometimes the story is serious enough that it doesn't really need the scary sound effects. The Perth The Weekend West's front page proclaimed, "You will get virus." Quoting the state's chief health officer, the newspaper said people should expect a hit rate of about 25%. So how does a 1 in 4 chance equate to you will get virus? More of journalism and maths, I suppose. And this from the Sunday Telegraph, Army joins virus war. War? Then there's the case of the Melbourne doctor we heard about on the weekend.
Good evening. A Toorak doctor who's tested positive for coronavirus is under fire tonight for continuing to see patients after he became ill.
A trusted and respected GP, Dr Chris Higgins, was a ticking time bomb. The father of singer Missy Higgins has potentially spread the deadly coronavirus to more than 70 patients.
I have to say I'm absolutely flabbergasted that a doctor who has experienced flu-like symptoms has presented to work.
A ticking time bomb? Really? Dr Higgins returned from the US, not a high-risk area, 11 days ago. He's hit back at the Health Minister.
Dr Higgins also breaking his silence, slamming Jenny Mikakos for reporting inaccuracies and unfairness after his mild cold had mostly resolved. Posting on Facebook, "I hesitated to do a swab because I did not fulfil your criteria for testing, but did one anyway. I believe you've taken a cheap opportunity for political grandstanding and would appreciate an apology."
I don't think he's got that apology yet. Last Monday, 9 News in Queensland wasn't exactly encouraging calm.
Queensland virologist Ian Mackay has suggested we can all start packing a pandemic stash box with up to 2 weeks' supply containing extra prescription medications, asthma relief inhalers, as well as over-the-counter anti-fever and pain medications, hand sanitisers and cleaning products such as bleach, toilet paper, tissues, disposable nappies and pet food, plus tinned fish, vegetables and fruit, as well as batteries.
Sounds like the zombie apocalypse. News.com.au aimed for the sensible centre. What items you need to stock up on to prepare for the coronavirus was the headline, but it stressed panic buying was counterproductive. Victorian Chief Health Officer Dr Brett Sutton advised readers on how to prepare if they needed to self-quarantine with no need to stockpile now. But it does require you to think about it, make some plans and understand what your needs are. The ABC provided feedback on what steps Australians have taken to stock up in case things get worse. One respondent put aside 2 months' worth of medicines. Another stockpiled a month's food for their dog. And Cheryl said it wasn't necessary to change her life at all and that she thinks stories like these frighten people and don't do anything positive or helpful. Scaremongering achieves nothing, she said. Perhaps they should have run a story by Cheryl instead. Still, the ABC's Dr Norman Swan calmly tackled some misinformation.
Masks are pointless. Your chances of walking past a person with the illness or being on the same train or bus as them are not much higher than winning the lottery. So by wearing masks, you're unnecessarily using a resource that's needed for health workers who'll be directly exposed to infected patients, and needed for people with the illness to cut the chances of them spreading it.
Sensible advice. But for the Keep Calm and Carry On award, the Northern Territory News outdid itself yet again.
In the spirit of, this toilet paper crisis, what we thought we could do for the people of the Northern Territory is print an 8-page list out in today's paper, and all as it is blank pages with cut out lines, and people can use it as toilet paper.
Right. Yep, you are still allowed to have a laugh. I can't wait for the crocodile coronavirus crossover story. But why are we seeing fights over toilet paper? Why the loss of Australian stoicism and our famed she'll be right attitude? Perhaps it's less to do with dramatic reporting from mainstream media, where there's plenty of information available to provide context. Perhaps the ridiculous overreactions are because so many people aren't consuming mainstream media news. Perhaps they're getting their news from social media, picking up on daily tripe and homegrown theories from Twitter and the like. This is the real challenge for authorities. how to communicate widely. If people are informed by Twitter, we shouldn't be surprised if they react with all the idiocy of Twitter.